Hello, my name is John Pilcher. I'm a bariatric surgeon in San Antonio. I've been in practice since 1995. This is No Shave November, and I'm going to talk for a minute about a serious patient concern that is dumping syndrome. Now, dumping syndrome happens more commonly in gastric bypass patients over sleeve patients, although I will have some important notes for sleeve patients coming up in just a moment, so don't leave me yet. Dumping syndrome is a set of symptoms that happen after gastric bypass patients take in serious amounts of sugar. I'm not talking about one scoop of ice cream. I'm talking about a full-on milkshake or something like a king-size bag of M&Ms. And what it feels like for these patients is, first of all, cramping abdominal pain, then nausea, throwing up sometimes, and sometimes diarrhea. And then there's a second phase that's a low blood sugar phase where people feel just really weak and tired and they have to lay down for a little while. And it's not dangerous, but it feels terrible. Back to sleeve just for a moment, and then I'm going to go into the pathophysiology of this dumping syndrome. Sleeve patients also should avoid sugars because sugars for sleeve patients also make the blood sugar fluctuate and disrupt metabolism, disrupt hunger, cause excess hunger, and so sleeve patients also should stay with proteins, green vegetables, healthy fats, and spicy foods, and avoid carbs and avoid sugars just like gastric bypass. So, back to gastric bypass primarily. Back to the pathophysiology of dumping syndrome, there are two phases. So sugars, from a chemistry perspective, are multiple tiny little molecules, and when these enter the small intestine, again we're talking about gastric bypass where you have your little stomach pouch and the jejunum attached to it, which is called the roulem, R-O-U-X, roulem. Pretty much right after you swallow your rice, for example, or your M&Ms, that sugar is going to go into your roulem and it's going to break down into its many little molecules. And these tiny little molecules, which are carbohydrates, simple carbohydrates, create a substantial osmotic load in the intestine, which causes water to rush in. Also, these many tiny molecules serve as an irritant, and so there are neurohormonal responses that make the intestine want to reject those many small molecules or those simple carbohydrates. And so the way the intestine tries to reject these is by spasming and just trying to rush them out. And mostly the intestine will try to rush all these molecules downstream, but it may push some of them back upstream, and that's where the nausea and retching and throwing up may come in for some patients some of the time. And that's where diarrhea may come in as this gets flushed out downstream. Now, the second phase that I mentioned, which happens about 45 minutes later, is a situation where most of these carbohydrates and sugars are not rejected, actually, even if the body tries to. Most of them are absorbed, and so large amounts of sugar get absorbed into the bloodstream very quickly. And so the blood sugar will spike up. And then because the blood sugar spikes up, the pancreas will get geared up and create its insulin, and it kind of overdoes it. And as the blood sugar was going to fall naturally anyway, now the insulin kicks in and it causes the blood sugar to crash down. And so it's interesting that low blood sugar after gastric bypass happens not from lack of food, but from the wrong types of food. So the wrong types of food cause the blood sugar to spike up temporarily and then to crash down, and the ill feeling comes when the blood sugar crashes down. That's called hypoglycemia. Now, I've got a whole nother video that's in process, hopefully in the next week or two, that's going to be all about postprandial hypoglycemia. So if you are a person who's experiencing recurring low blood sugars after your gastric bypass, in spite of doing the right things as far as you can tell, check out that other video. Again, it's postprandial hypoglycemia. You'll be able to find that on search terms on YouTube. Now that we've covered the science of dumping syndrome, let's talk about how it shows up in practical reality for most patients, and I think this is actually reassuring for most people. Most often, people are most sensitive to dumping syndrome. In other words, the least intake will kick it off during the first 2 or 3 months after the surgery, and then the intestine naturally adapts to food intake and it becomes much less sensitive over time. During that first couple of months, most people will experience dumping syndrome twice, just twice. Once, interestingly, is when people test the body to see if dumping syndrome really happens. And I might do that. I'm not sure if I would do that, but it seems to be human nature. And you could do that with orange juice or apple juice or, again, the M&Ms or something along those lines. I do not recommend it, but that's often happens. The second time that dumping syndrome happens most often occurs when patients are in a social eating situation, or they're out to eat and they didn't realize that some recipe, for example, barbecue sauce, contained a lot of sugar. And so some unexpected food intake take may cause dumping syndrome. That happens to people often just one time, and then they're very aware of food content and recipes, and it doesn't happen again. And here's the key point, is that most gastric bypass patients in the long run are happy about the potential for dumping syndrome without actually having dumping syndrome, because the potential or the awareness that it could happen helps keep them on the straight and narrow with their food plan in the long run.